Today is not about looking fabulous. Today we are going to do a Dr. Pet microneedling. I'm going to tell you what to look out for when you go for your microneedling. As a professional somatologist, I get to do this all the time because I'm a professional, always. Best practice to go have this treatment done. But I know a lot of you have your own microneedling pen, so I'm going to teach you how to do it the right way. First things first, get all your hair out of your face. Not a drop of hair can touch your skin. If you don't have gloves, take alcohol swabs or sanitizer and sanitize the living life out of your hands and your pen. Everything, nails included. You can either sanitize your face with an alcohol swab. For me, it's a little bit too drying at the moment because it's winter, so I'm going to use a hypochlorous spray. And I get a brand new cartridge. You do not reuse your cartridge. You do not use it, then dip it in alcohol and think that it's all clean, ready for the next use. You use it once, you chuck it away. If you've been doing microneedling incorrectly, reusing stuff, and you're creating micro tears, you are going to land up with so much scar tissue. It's going to look like, ew. I've got my cartridge, I've still got the cap on, and we lock it in. Make sure you have got a serum for slip. If you are unaware of which serum to use, a hyaluronic acid serum is always your safest bet. But you need some kind of slip because the thing gets stuck. Do you see? It's going to pull the skin and it's going to create tears. Today, I'm going to be using the KRX thread-filled ampoule with absorbable collagen threads inside. It's one of my favorite things to use. That's all ready. As soon as I'm ready to go, all I need to do is take this protective seal off and apply it to my face. But because I touched this, and I'm touching my face, I have to still sanitize this and then re-sanitize my hands. That is how hectic I am about hygiene. And we're going to go section to gently apply to the entire area that I want to do. The pen that I'm using is the A8S, and I absolutely love the A8S. I'm taking the hygiene cup off. I'm going to start it. So you can see the needles going in there. Number one, can you see the vibration? That is it going up and down at a very fast rate. And there's a reason why we glide. You are applying extra pressure when you are stamping the whole time. I don't like that. You don't need extra pressure. The pins are going up and down on themselves. All you need to do is a gentle glide over the area and allow the pins to go up and down, oscillate for themselves. Over here, you can actually see all the numbers. I want it on a 1.5. 1.5 is quite deep. It does get quite painful, and I didn't put numbing cream on. Ow. Makes me sneeze. You do not have to bring blood to the surface for your dermapen to work effectively. The aim is to go vertical, then horizontal, and then diagonal. And now I'm going to switch to a 0.5 because my top lip and my eyes are very sensitive. Actually, a 0.25. Throw it away. I'm not gonna lie, that was a tough one. Home care, aftercare is just as important. This feels exactly like a sunburn. You need to take great care into your skin afterwards while it's open, while it is exposed. I'm going to take more of the serum from KRX Aesthetics and I'm going to apply it all over. It's amazing. You should not wear makeup after this at all. Just like a sunburn, your skin feels hot. It is inflamed, it is open, it is exposed, it's red, it feels like a sunburn. When you put a covering over it, it is going to burn. It is going to get hotter. It's going to trap all that heat underneath that makeup. It should be a serum, something that's breathable. My suggestion would be to do this on a weekend. You're going to need a few days to recover, especially from the redness. Do not walk out of any place with your face exposed like this especially if you are pigmentation prone. Please believe me, the sun is going to make it burn like hot fire. Your pigmentation will explode, and if you have melasma, that takes forever to go away. You'll just cause more harm than anything else. Hygiene is also still very important. Keep your hair out of your face. Don't touch your skin. I have been doing this for the longest time, and it is one of the best treatments to do by far. Almost anyone will tell you the same thing, but it works. Even though I look like a bit of a cartoon character right now, I don't care. All right, my skin is going to look flippin' amazing in a few days. And everything I got here, my pen and Carex aesthetics, you can get from Dermarollersystems SA. Look after yourself. This is a wonderful treatment to do.